Don't look now, but that silly medical student is looking at us. I bet they don't even know how to do an abbreviated mental test score.
I know they are so silly.
Oh, hello. We were just saying how clever you looked. Would you like to learn how to do an abbreviated mental test score? This is the fourth and final video in my series. I'm Dr. Pinky. My videos are designed to introduce medical students to basic mental health topics. They won't tell you everything but should be used as helpful learning resources to improve your clinical skills. This video will help you get started with abbreviated mental test scores.
An abbreviated mental test score is a method of cognitive assessment and a way to rapidly assess for confusion and other cognitive impairments. It is important to remember it is only a screening test and is not a diagnostic test.
The abbreviated mental test score gives you an idea of the patient's orientation.
That means where the patient thinks they are, in respect to time, place, and person.
It also tests their attention and concentration, which are important factors to consider when assessing a patient's cognitive function.
Lastly, it gives an idea of the patient's memory. This can be severely compromised in some patients.
To give you an idea of how an abbreviated mental test score is performed, I will do one on Mrs. Snuffles. First, identify the patient and ask them if it is okay if you ask them some questions. Explain what you are going to do and that you want to check how their mind and memory are functioning. Now the questions for the test. How old are you, Mrs. Snuffles?
I am 22.
What is your date of birth?
It's the 21st of September 1988.
What is the year?
It is 2011.
What is the time of the day?
It's the morning.
I want you to remember this address. It is 42 West Street.
Okay, no worries.
Which building are we in now?
We are in the Health Science Library, doing some science.
Who is the current monarch?
It is Queen Elizabeth II.
What was the date of the First World War?
The summer of 1914 and lasted until November 1918.
Can you count backwards from 20 to 1?
Yes, but no one wants to watch a video of that. So let's just assume I can.
That is okay. Can you recognize two people for me?
Yes, you are my doctor, Dr. Pinky, and that is the silly medical student.
Excellent. Now lastly, can you remember that address for me?
Yes, it was 42 West Street. Did I do well in the abbreviated mental test?
Yes. You answered each of the 10 questions correctly. So you get a score of 10. A score of 6 or less suggests severe cognitive impairment. The score should be used in conjunction with a history and examination to help formulate a diagnosis, and further and more formal tests are necessary to confirm the diagnosis.
I hope you now know how to do an abbreviated mental test.
We hope you enjoyed this video. You should now have seen all my mental health videos. Well done if you have. If you've missed one, check out my channel to catch up. Feel free to use these videos as much as you like, and remember to use other resources to cement your learning. Thank you and good luck with your studies.